Sorry, there was no voice. I had muted my microphone, but I didn't know. So I'll repeat what I just said. So dermatomyositis. Dermatomyositis, as its name indicates, it's inflammation of muscles and the skin. So someone with muscle weakness, proximal muscle weakness, and skin manifestations, your diagnosis will be dermatomyositis. So we have got another differential diagnosis of proximal muscle weakness, and that is dermatomyositis. So someone with proximal muscle weakness, such as difficulty in rising from chair, climbing stairs, combing the hairs, and skin manifestations, such as heliotrope rash, that is blue or purple discoloration of the upper eyelid with peritibial edema, Gauthron's papules. Gauthron papules are basically red scaly patches over extensor surfaces of the joints and fingers, as shown in this diagram. These red patches over the extensor surfaces of joints and fingers, these are Gutron's papule. And shawl sign rash around the neck. So these skin manifestations along with muscle weakness, your diagnosis will be dermatomyositis. Initial investigation, because it's a myositis like polymyositis, so creatine kinase, LDH, and hydrolase, they will all will be raised. And the definitive diagnosis will be on a muscle biopsy. Treatment is like polymyositis, the treatment is steroids and also sun blocking agents for skin manifestations. So the difference between polymyositis and dermatomyositis is only a muscle weakness. While on the other hand, dermatomyositis along with weakness muscles, there are skin manifestations such as Gauthron's papule, heliotrope rash, and shawl sign. Creatine kinase is high in both of them. Anti-nuclear antibodies such as anti-Jo antibodies, they are present in both of them. So this was all about dermatomyositis. Now our next topic is chronic fatigue syndrome. What is chronic fatigue syndrome? Chronic fatigue syndrome is also known as myalgic encephalomyelitis. It is a chronic condition and is a diagnosis of exclusion. You need to rule out all the other diagnoses of muscle weaknesses, and then you will label the patient as chronic fatigue syndrome. The presentation is mostly post-exertional malaise, activity-induced muscle fatigue, and due to this muscle fatigue, there will be cognitive dysfunction, sleep problems, and generalized pain. Chronic fatigue syndrome is diagnosed after at least 4 months of disabling fatigue, both mental and physical, function more than 50% of the time in the absence of other diseases which may explain the symptoms. So the main presentation of chronic fatigue syndrome is exertional fatigue and cognitive dysfunction or sleep problems with normal investigations and at least 4 months of disabling fatigue that is affecting person's mental and physical function Epidemiology is that it is more common in females. There's one condition in psychiatry, that is somatization disorder, in which the person will present to you with multiple unexplained, medically unexplained symptoms. So there will be multiple unexplained symptoms in somatization disorder, while in chronic fatigue syndrome, the main complaint is chronic fatigue syndrome. Investigation in both these cases will be normal. And there will be history of at least 4 months of disabling fatigues. And there's no association of chronic fatigue syndrome with past psychiatric history as well. And the other point that you need to remember that is specific for chronic fatigue syndrome is that uh, normally there will be a history of flu-like symptoms, after which the person will develop this chronic fatigue syndrome. So if someone develops fatigue and cognitive dysfunction after a history of upper respiratory tract infection or flu-like symptoms, and the main presenting complaint is chronic fatigue, due to which the person develop a cognitive and mental dysfunction and insomnia, etc., then your diagnosis will be chronic fatigue syndrome. What are the investigations? All the investigation will be done to rule out the other causes of muscle weakness: full blood count, urea electrolyte, LFT, glucose, thyroid function test, ESR, CRP, calcium, CK, ferritin. All the causes, all the investigations will be done. And if all of them are normal, then we'll label the patient as a patient of chronic fatigue syndrome. Management is cognitive behavioral therapy and graded exercise therapy. Graded exercise therapy is basically an intervention technique that utilizes physical activity as the principal treatment method for addressing the symptoms of chronic fatigue syndrome. It promotes engagement in a program of physical activity that starts very slowly. So physical activity is started very slowly and then it is gradually increased over time. This is known as graded exercise therapy. So cognitive behavioral therapy and graded exercise therapy are the treatment modalities that can be used in the management of chronic fatigue syndrome. Let's do an example. A 26-year-old female presents complaining of easy fatigability even with little exertion. So fatigability with exertion, recurrent headache, difficulty sleeping, difficulty concentrating, and body aches everywhere. These symptoms have been persistent for the last 5 months. So fatigue, and due to fatigue, there is difficulty in sleeping and concentrating. And the symptoms is present for more than 5 months. So disabling fatigue for more than 5 months or more than 4 months, you will think of chronic fatigue syndrome. She says that these symptoms began after a viral infection. So the symptoms of exertional fatigue, they started after a viral infection. So it is most likely chronic fatigue syndrome. FVC, KFT, LFT, TFT, all of them are normal. And the diagnosis is chronic fatigue syndrome. So this was all about chronic fatigue syndrome and how to diagnose chronic fatigue syndrome and its management. Now we are done with the causes of muscle weakness, such as polymyositis, polymyalgia rheumatica, dermatomyositis, and chronic fatigue syndrome.
Question about
Yes.
chronic fatigue syndrome. So you said all these symptoms are present with no significant psychiatric history, right?
Yes.
Okay. Thank you.
If a psychiatric history is present, then your diagnosis will most likely be somatization disorder. And in somatization disorder, the person complain of multiple medical symptoms such as headache, abdominal pain, pain in the legs. So there will be multiple symptoms which cannot be medically explained with one condition. Because in the exam, the questions will be random. So you won't know that you need to know these points to differentiate between somatization disorder and chronic fatigue syndrome. The main point is
Sure.
that in chronic fatigue syndrome, the main presenting complaint is exertional fatigue that starts usually after a viral infection. These are two main points on the basis of which you can differentiate between somatization disorder and chronic fatigue syndrome.
Okay, so for chronic fatigue syndrome, there is always a history of
Yes, usually, normally, the chronic fatigue syndrome it starts with uh, after a viral infection.
okay, and that could be like a simple cold or
Yes,
like a
simple flu
complex
or cold.
viral flu
No,
or
no,
cold.
simple flu, simple viral flu.
Okay, and what are the successes, like the outcomes after you've done the management?
The success is very much helpful in the form of cognitive behavioral therapy and exercise, graded exercise therapy. They can almost cure the chronic fatigue syndrome.
Okay, thank you for that explanation.
Even if viral infection is not given, and the main complaint of the patient is exertional fatigue, then
This is in the
again you will,
exam. This is in
yes,
the
this is
exam
for
or in real life?
uh, in real life as well as in the exam. Even if there is no history of viral infection,
Yeah.
if the main complaint is chronic fatigue, exertional fatigue, which lead to cognitive and physical dysfunction, then you will think of chronic fatigue syndrome. But in Plab 1, usually the history of viral infection will be given.
Okay, got it.
But the examiners of Plab exam, they sometimes like to trick the students. So that's why even if the viral infection history is not given and the main complaint is fatigue, then it will be chronic fatigue syndrome. So our next topic is